You know what's really strange about health insurance in America? Isn't the paperwork or the price, or even the fine print that looks like it was designed to discourage literacy. It's the way it behaves like a person. Not a system, not a service, but a very specific type of person. The kind who is warm and attentive and deeply interested in you right up until the exact second you actually need something from them. When you don't have health insurance, you are suddenly fascinating. You are worth someone's time, worth a follow-up call, worth an email, worth a gentle reminder. And companies reach out to you like you're a long-lost friend they swear they've been meaning to check on for years. They ask how you're doing, how your family is, what your plans are. And they speak in this calm, reassuring tone that makes you feel like someone out there genuinely cares whether you're okay or not, like you've finally been noticed. They say things like, "We just want to make sure you're protected." And they let that word hang in the air for a moment, protected, as if life itself is some kind of active threat, and they just happen to sell the only shield strong enough to survive it. They talk about peace of mind like it's a real object, like it's something you can buy, something that comes in a box, something that will sit quietly on a shelf until the day you need it. And they explain coverage in language that's soft and rounded and carefully designed to avoid sharp edges. Nothing sounds complicated, nothing sounds urgent, nothing sounds dangerous. Everything sounds manageable, reasonable, comforting. And before you even realize it, you're nodding along, thinking, yeah, this makes sense. This feels responsible. This feels like what an adult is supposed to do. And signing up is unbelievably easy, almost suspiciously easy. 5 minutes, a few clicks, a credit card number. No paperwork that actually matters, no friction, no moment where anyone asks if you're sure. It feels modern and optimized, like ordering food from an app. And when you hang up the phone, you think, wow, that was painless, and you feel grown up, you feel mature. You feel like you just checked off a box on the invisible list of things you're supposed to do to be a functioning human being. And for a while, everything works perfectly. The payments come out exactly on time every single month, not a second late, not a dollar missing, no errors, no confusion, and the system suddenly becomes incredibly intelligent when it's collecting your money. It remembers your name, your policy number, your billing date, your payment method. It never forgets, it never needs clarification, it never asks you to resend anything. And that part of the system is flawless, honestly impressive, almost beautiful in its efficiency. And then, one day, something happens. Not a dramatic disaster, not an ambulance with sirens, just something boring and real. A pain that doesn't go away. A fall you laugh off until you realize it still hurts the next morning. A doctor who looks at you and says, maybe you should get this checked. And suddenly, the thing you bought for peace of mind is supposed to do what it promised. That's when the personality changes. Nobody ever says no, because no would sound cruel and obvious. So instead, they say, we just need a little more time. And they say it politely and professionally and calmly, like time is something you have an unlimited supply of while you're sitting in discomfort or anxiety or fear. You call the number on the card, and a cheerful automated voice thanks you for calling and assures you that your call is very important. And then you're placed on hold, and suddenly you're listening to music that feels like it was specifically chosen to test how long a human being can remain calm before losing faith in civilization. The music loops, it pauses, it restarts, minutes pass, then more minutes. Time stretches in a way that makes you aware of your own breathing. Your phone gets warm in your hand, your thoughts wander, and eventually someone answers and asks for your name, your date of birth, your policy number, confirms your identity, and then transfers you to another department. That person asks the same questions again in the same calm voice, sounding relaxed and friendly and completely unbothered, like they're having a perfectly normal day. And nobody sounds rushed, nobody sounds concerned, nobody sounds like what you're calling about is urgent in any meaningful way. You're asked for documents and you send them. Then you're asked for the same documents again and you send them again. And you're told your case is under review. And at some point, you start wondering what exactly is being reviewed. The fact that you paid every month, the fact that you followed the rules, the fact that you're clearly not calling because this is fun. But you don't say any of that out loud because now you're polite too. Now you're learning the rules of the conversation. Then comes the deductible,
a beautiful word, a polite word, a word that sounds reasonable until you live inside it. The system's way of saying, we care, just not enough yet. Deductible teaches patience, it teaches endurance. It teaches you exactly how much pain, discomfort, or risk you're willing to tolerate before you push back. And it quietly encourages you to wait, to delay, to hope the problem resolves itself, because hope is cheaper than treatment. And if you choose the wrong doctor, the wrong hospital, the wrong clinic, or even the wrong hallway inside the right building, that's not a tragedy, that's an educational experience. And education has tuition. Nobody yells, nobody breaks the law, nobody violates policy. They simply send you a bill, calmly, quietly, legally. And what's funny is how fast everything moved when you were signing up, how smooth it felt, how effortless, and how slow everything becomes the moment you actually need help. And that's not a mistake or an accident, it's the design. Because every extra day your case is under review, every extra phone call you don't make, every form you're too tired to send again, the system wins. Not because they denied you, but because you stopped pushing. They don't need to reject you, they don't need to argue with you, they don't need to say no, they just need to wait you out. Eventually, something shifts and you start questioning yourself, wondering if you're being dramatic, if this is worth the stress, if you should just deal with it on your own. And right there, in that moment of doubt, the system works exactly as intended. Not aggressively, not illegally, just patiently. Health insurance doesn't make the most money when you're sick. It makes money when you're healthy enough to keep paying and tired enough to stop calling. They profit from hesitation, from delay, from people deciding that peace is cheaper than persistence. So if you've ever hesitated before going to the doctor, if you've ever hoped pain would just go away, if you've ever stared at your insurance card and sighed before dialing the number, that's not weakness, that's conditioning. Because in this system, they are incredibly enthusiastic when you're healthy and incredibly understanding when you're waiting. And they don't abandon you or disappear. They simply give you all the time in the world to quietly remove yourself from the conversation, and they call it coverage. And at this point, let's stop calling it a service, because this is a machine, carefully and politely engineered to do one thing extremely well: limit your benefits in the most legal way possible. Not by openly saying no, but by slowly wearing you down until you say it to yourself. They don't need to block you from healthcare. They just need to make it exhausting enough, confusing enough, inconvenient enough that you decide maybe you'll deal with it later. Every process, every department, every form, every case that's under review isn't random. It's padding, it's filtration, it's a funnel designed to keep money inside the system for as long as possible while nudging you out as early as it can. They call it procedure, policy, industry standard, while you call it another afternoon listening to hold music as your body quietly reminds you that something isn't right. And the most infuriating part is how polite they are about it, always apologizing for the inconvenience, always thanking you for your patience, as if patience were a virtue, not a symptom of being trapped. Slowly, you stop demanding your benefits and start begging for them, hoping for a review, a workaround, an exception, even though what you're asking for is something you already paid for. And when you're finally exhausted, when you accept living with pain, risk, or uncertainty just to avoid one more phone call, the system hasn't beaten you with force or authority. It's beaten you with delay, with fatigue, by turning your rights into a test of endurance. This isn't healthcare, it's a waiting game, where the reward for the public is silence, and the reward for the system is another month of money kept on hold. And they still call it insurance, with a perfectly professional smile.